Evening, everyone. On the behalf of Team DentistChannel.Online, I would like to extend a very warm welcome to all of you. I am Dr. Aditi Mishra, and I'll be the host for today's session on the topic Management of Mandibular Subcondylar Fracture through an intra-oral approach using a transbuccal trocar with ramus buccal decortication by a retrospective study by Dr. M. Shreya Jaiswal. So before starting with the session, I have few housekeeping notes to make. If you have any doubts during the session, you can put your questions in the question and answer box present in your control panel, and we'll be taking up each and every question at the end of the session. If you have joined us from Facebook and YouTube Live, you can ask us questions by commenting, and we'll be answering them at the end of the session. So without further ado, I would like to introduce our today's speaker to everyone. Dr. Jaiswal is dentist by profession and currently residing in Busan, South Korea. She has graduated in dentistry from Vananchal Dental College and Hospital, and currently she's pursuing masters in oral and maxillofacial surgery from Busan National University, South Korea. She's also working as a researcher. She has attended various seminars, webinars, and conferences, and actively presented research papers and oral health paper presentation in various international platforms. She has also worked with Colgate in their project Bright Smile, Bright Future during childhood. She has joined Nanjil Anand Foundation NGO as health coach and was appointed as official campus ambassador of International Model United Nations. Over to you, Doctor.
Hello, everyone. Good evening. It's 8:30 in Korea now. So yeah. So let me introduce as Dr. Aditi. She has already introduced me. So yeah, without any delay, I think I should start with my presentation. And yeah, here it is. Actually, my presentation is basically based on a topic of oral maxillofacial surgery, as I'm pursuing that here. So, Dr. Aditi, is it, can you see my?
Yes, it's visible. Please go ahead.
Yeah, sure. So yes, my topic is management of mandibular subcondylar fracture through an intra-oral approach using a transbuccal trocar with ramus buccal decortication. So we all know that we have, in day-to-day life, nowadays especially, aesthetic is a prime concern. So we don't need any scar on our face, right? So this is basically, this studies basically deal with that only. So my presentation outline is like introduction, objective, patients and methods, surgical procedures, statistical methods, results, conclusion, and references. So we all know that mandibular condyle accounts for 20 to 52% of all mandibular fracture, and the treatment purpose of this fracture is to restore the function of the condyle through anatomical reduction and stable fixation. In the selection of the treatment methods of the condylar and condylar neck fracture, we all know that there are several approaches to deal with such fractures. So there are few things now that need to be taken into consideration, and they are given in the point as follows. First is complexity of the function and the anatomical structure. Second is patient's age. Third is fracture pattern. Fourth is associated damage. And the fifth one is association with the related anatomical structures. So we have two types of reduction surgeries. First is the closed reduction surgery, and second is the open reduction surgery. So here what we are dealing with is the open reduction surgery. Okay, and this open reduction surgery, it is again categorized into intra-oral approach or extra-oral approach. So most of the surgeons, they prefer extra-oral approach because of the direct accessibility, and it also enables accurate bone fragment fixation. But it has a very severe disadvantage, that is facial nerve damage and post-operative scarring. So Here we will mainly see about the intra-oral approach because it is mostly preferred over here. And it requires only a pinhole-sized stab incision that reduces the scarring and enhances the accessibility. In the figure given below, you can see this patient underwent through a surgery through an extra-oral approach, and you can see the post-operative scarring over here. So the main purpose of this study was to analyze that which approach, whether intra-oral or extra-oral, which approach is more effective in terms of aesthetics and complications. So post-operative occlusion recovery, reduction of distance between bone fragments, and degree of nerve damage of both the approaches were compared to help in selecting a more effective surgical method. Okay, so here is a diagram of the transbuccal trocar that we used in the surgical procedure. And you already know that the subcondylar area, if you don't know, please look at the figure over here. So this was a kind of retrospective study, and we took around 47 patients from our oral and maxillofacial surgery department. And this retrospective study, we got this data, and this data was collected from our department. And between August 2015 to November 2020, we took the patients and we evaluated them. So out of which 38 patients, we selected them, and out of which 17 patients underwent intra-oral approach surgery and 21 patients through extra-oral approach. So after this, selecting patients, we evaluated the gap between the bone fragment through a panoramic radiograph pre and post-operatively. So condyle fractures were classified as described by Spiegel and Scroll. It means the classification, because we know that there are various mandibular classification, yes, mandibular fracture classification, but yes, we considered Spiegel and Scroll classification, and here the types are given as: first is fracture without displacement or dislocation, second is low fracture with a displacement, third is high fracture with a displacement, fourth one is low fracture with a dislocation, and fifth one is high fracture with dislocation, and sixth one is intra-capsular fracture. So in our study, 19 cases were of type 1 and 7 were of type 2, and rest were from this rest 4. Okay. So this is the table of age and sex distribution of the patient with the subcondyle fracture, and you can see here the age was from between 8 to 81 years of age, and the mean age which was considered was around 47 plus minus 17 years, right? So this intra-oral approach, 17 patients were there, and in extra-oral there were 21 patients, as I already told about it. So coming to the surgical procedures, so we will discuss about both the intra-oral approach and the extra-oral approach. But yes, when the patients came, many patients underwent multiple surgeries at different sites. Okay, but the patients who were having symphysis fracture, so first we fixated that, and then we moved with the certain procedures. First, talking about the intra-oral approach, so an incision was made along the external oblique line. I hope you all know where this external oblique line is present. And then we give 5 mm incision on the skin which surrounds the fracture surface. And then trocar, as I already showed you in the diagram, the trocar was inserted using 1.5 mm drill. And then further procedure was carried out, and this that fracture was fixated. And in between that, buccal cortical bone, we removed it for accurate fixation or accurate reduction, you can say that. And Bosman solution, electrocautery, and gauge packing, everything were used to restrict the hemostasis. And stainless steel wire was used for the intermaxillary fixation, as you can see in the diagram given here. And in this patients, the patients who were from the intra-oral approach, we used bridge type titanium plate and 6 mm fixing screw. When talking about the extra-oral approach, we depending on the fracture line location, we have taken various approaches. Either it is posterior mandibular or lower mandibular or metastatic graft approach. And here, among 21, in 2 patients, we used L-type 4-hole mini plate, and in rest of the patient, we used the same screw or same mini plate as we have used in the intra-oral approach patients. But main thing that we need to take into consideration is in external approach, there is a very high chance of facial nerve damage. So just we have to take into consideration that we have to avoid the facial nerve damage over there. There are few similarities in between both the approaches. There were post-operative intermaxillary fixation was performed using 3/16 heavy elastic rubber, as you can see here in the diagram, and the panoramic radiography and 3D CT were performed. So here in the diagram, you can see before buccal decortication and after buccal decortication, what was the difference between it. So in after buccal decortication, you can see there is a very good accessibility over there. You can see the bone and there were limited scarring. So yes, and this result fixation via external approach, and it was accompanied with a buccal cortical bone resection. Okay. And in the given diagram, you can see the amount of buccal decortication in the model. So we just decorticated this much part. When talking about the statistical methods, so the complication rate after the open reduction surgery, it was evaluated by SPSS version 18.0. And to determine the significances of the intergroup differences, we used chi-square test, and to determine the significances of difference between the post-operative bone fragment distance, independent variable t-test was used. So the statistical significance was accepted for p-value less than 0.05. So coming to the result part, so when finding out the result, we got that the etiology of the fracture of the 38 patients, the most common etiology was slip down, and rest comes like fist trauma, sports trauma, outcar traffic accident, motorcycle traffic accident, and so on. Here we selected 9 patients who received the subcondylar fracture surgery. We have excluded the patients who underwent multiple reduction surgery at another site. Okay, so out of which 2 patients were from internal approach using trocar, and 7 patients were from external approach. Here we evaluated the mean operation time between both the approaches. The internal approach, the mean operation time was 75 minutes, and in external approach, it was 103 minutes. It means the mean operation time of external approach is quite high or quite long as compared to the internal approach. In this table given here, you can see the gap measurement. It means the difference between the gaps in the intraoral and the external approach. It is as follows. So yeah, in intraoral, the distance was around 1.27 millimeter, and in external, it was around 0.72. So the p-value was around 0.020. So there is no any statistical significance difference. Now talking about other complications, post-operative complication, you can say. So first thing, what we took into consideration is the occlusion. So all patients were all good, but yeah, there were 5 patients who showed the unstable occlusion, out of which 2 were from intraoral and 3 were from extraoral. So this all 5 showed normal occlusion within 1 month. Each of the patient, they complained of pain while opening the mouth and for the clicking sound, but these all things resolved within 6 months. But one patient who was from the internal approach underwent intracentesis. The reason was due to the prolonged intermaxillary fixation. Okay, and another clinical dysfunction distribution is given at the table. I have already discussed about the unstable occlusion when now talking about the TMJ dysfunction. So 1 patient from intraoral and 5 patients from the external approach underwent to this TMJ dysfunction, right? And then next coming about the paresthesia and then weakness. You can see here that there were no patients from intra-oral approach who have showed this symptom like weakness. So now taking a conclusion part. So complications such as metal plate fracture, screw loosening, and infection, these things did not occur in any of the approaches. But in external approach, what we saw is that the operation time was longer and facial nerve damage and extraoral scarring was observed. Next is that after the open reduction surgery of the mandibular condyle fracture, the mean fracture distance of the extraoral approach was smaller than that of intraoral approach, but there was no significant difference between them in the healing pattern. And then favorable results can be obtained in the mandibular condylar fracture surgery by minimizing scarring and securing accessibility using a trocar and sufficiently securing the field of view through buccal cortical bone reduction. So I think you all understood that how important it is. We should take conservative approach, right? So external approach, we know that it is very easy thing to do the external approach. I'm not saying easy, but yes, when compared to the intraoral, it is easy because you can see it is having a wide view, right? But intraoral is a thing which is more concerned nowadays just because of the aesthetic concern. So thank you for this session. And if you have any query or any questions, you can just drop it there in the chat box. Thank you.
Thank you so much, Dr. Shreya, for this amazing presentation. And I hope a lot of participants would have got their doubts cleared and would have got introduced to this new thing. So before moving on to the question and answer session, I request all the participants to kindly put their questions in the question and answer box if you have any doubts. And before that, meanwhile, I will be introducing our participants to our organization. So we are DentistChannel.Online with the motto Healthy Smiles that leads to wealthy lives. I request all the participants to kindly log on to our brand new website, www.DentistChannel.Online, and you can find us on Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, and Telegram. We are proud to say that we are the first digital dental media marketing company in India, and we are catering to academic, professionals, and commercial needs of dental students, practitioners, organizations, businesses, and dental industry leads. And we have conducted a lot of webinars and a lot of workshops till date, and we are striving very hard to bring all the dental practitioners, students, and the whole fraternity under one roof and creating opportunities for everyone. So these are few things that we cater for each and every group. So like for dental professionals and dental students, we do webinars, we do courses, a lot of events, dental businesses. You can submit your scientific articles on our website. And being to a Prime member, you can avail a lot of benefits. So just have a look on the benefits that you avail. So you can publish your articles and e-posters on our website. You can connect to other dentists and other dental students, and you will get to know the new things and how practices is going at their place and everything. Plus, you will be getting e-certificate for each and every webinar that you attend only if you're a Prime member. So and the annual membership will cost you just 799 rupees. And if you're using my promo code ADT100, you will be getting one assured discount. So I request the participants to kindly make a note of it. Use my promo code ADT100 while subscribing for the Prime membership, and you will get the discount. So this is the upcoming webinar of the day. At 7 p.m., we'll have Dr. Dennis with us for holistic dentistry, homeopathic remedies for common dental problems. So kindly stay tuned. Next week, next Sunday, we are coming with the precision attachments at 7 p.m. and the art of interpreting the different shades of gray at 9 p.m. Basically, this webinar with Dr. Ankit Jain on the art of interpreting the different shades of gray will be describing what we are coming up with our online workshop in March. Okay, so we are coming with this online masterclass for 3 hours on atraumatic extraction techniques by Dr. Kushal Gangwani. Our seats are limited and the seats are filling up very fast. I request participants to kindly enroll themselves as soon as possible. In March, we are coming with, in the first week, we are coming with online workshop on forensic odontology batch 3. After the huge success of batch 1 and 2, we are coming with batch 3 with Dr. Arushi Chavla. On 6th of March, we are coming with Dr. Jaina Gandhi, Communication, the Key to a Successful Dental Practice. And this will be a masterclass for 3 hours. We have already got one webinar with her, and I'm sure that you would have got a gist about what we will be doing in our masterclass. So do subscribe for the same. And on 13th of March, again, we are coming with Dr. Ankit for the masterclass, The Art of Interpreting the Different Shades of Gray. If you have to, I request all the participants to kindly make a note of this number. Kindly send your name as a text message on this number on WhatsApp, and you will be added to our broadcast list. And after that, you will be updated regarding each and every upcoming events that we have. Our sponsors, Novamind GmbH, they have the innovative dental and healthcare solutions to ensure our success. And in any case, if you have missed out to our live session, you can go back to our Facebook and YouTube channel and watch our recorded videos there, recorded sessions there. And for all the information and all the tips and tricks, you can subscribe to our Instagram channel with the handle DentistChannel.Online. Okay. So before ending the session, Dr. Shreya, any takeaway note for our participants?
Yeah, sure. Actually, the thing is that this approach, what I talked about, is very important nowadays because everyone is concerned of its aesthetic. No one wants a scar on their face, right? So this intra-oral approach is a big thing, and we all know that the extra-oral approach, as I already discussed, it is very easy, and most surgeons prefer this. But you can see the difference between both the approaches, and I think we all should use this intra-oral approach because what I saw is that the complication is also less over there. There's no scarring. The most important thing is that there is no facial nerve damage, which is very most important thing. Yeah.
Yes, absolutely. So thank you so much, doctor, for coming with us, and we are looking forward for more sessions with you. And I'm sure that this is going to be very helpful for all the practitioners out there. Thank you so much for being with us.
Thank you. Thank you so much. Thank you for the opportunity.
Thank you to all the participants who have just now enrolled with us. And with this, we are ending today's session. Thank you so much and have a great evening ahead.